Struggling to remember heart failure details? Don't worry, I've got the best mnemonics to make it simple. These memory hacks will help you ace your exams and boost your clinical confidence. First, when assessing a patient with heart failure, a structured approach is key. Let's break it down using the ABCDE method. A. Assessment. Check for heart conditions, recent hospitalizations, and worsening symptoms like shortness of breath and swelling. B. Blood exams or blood gas analysis. Run BNP, troponin, renal function, and ABG tests to assess heart strain and metabolic balance. C. Chest X-ray. Look for fluid buildup, pleural effusion, or an enlarged heart, classic heart failure signs. D. Dysfunction. Heart and lung ultrasound. Use ultrasound to check heart function, fluid overload, and pericardial effusion. E. Electricity, implantable devices. Check pacemakers or ICDs. They may need reprogramming in heart failure cases. Second, heart failure is complex, but remembering its causes doesn't have to be. Use the heart-failed mnemonic. H. Hypertension. Chronic high blood pressure puts constant strain on the heart. E. Endocarditis. Infections in the heart valves can lead to heart failure. A. Anemia. Severe anemia weakens the heart over time. R. Rheumatic heart disease. Past rheumatic fever can cause lasting heart damage. T. Thyroid disease. Both hyperthyroidism and hypothyroidism affect heart function. F. Failure of coronary arteries. Blocked arteries starve the heart of oxygen. A. Arrhythmias. Irregular heartbeats reduce cardiac efficiency. I. Infections, myocarditis. Viral infections can directly weaken the heart muscle. L. Lung disease. Conditions like COPD or pulmonary hypertension overload the heart. E. Embolism. Blood clots can block circulation, leading to failure. D. Diabetes. Increases heart disease risk, a major heart failure cause. Third, heart failure treatment can feel overwhelming, but remembering key meds is easy with the Band-Aid mnemonic. B. Beta blockers. Slow the heart rate and improve survival, like carvedilol or metoprolol. A. ACE inhibitors. Lower afterload and boost survival. Think lisinopril or enalapril. N. Nitrates. Reduce preload and relieve symptoms, like isosorbide dinitrate. D. Diuretics. Eliminate excess fluid. Furosemide and spironolactone work great. A. Aldosterone antagonists. Reduce fluid retention and improve survival, like spironolactone eplerenone. I. Ivabradine. Lowers heart rate in patients with sinus rhythm. D. Digoxin. Improves heart contractility and controls atrial fibrillation. Fourth, treating chronic heart failure with reduced ejection fraction, HFrEF, starts with 4 key medications. Just remember ABAL. A. ACE inhibitors, or ARBs, lower afterload and improve survival. Think lisinopril, enalapril, losartan, or valsartan. B. Beta blockers, slow the heart rate, decrease oxygen demand, and boost survival. Carvedilol, metoprolol, or bisoprolol. A. Aldosterone antagonists, block aldosterone to reduce fluid retention, like spironolactone or eplerenone. L. Loop diuretics, eliminate excess fluid and relieve congestion, furosemide, bumetanide, or torsemide. Fifth, heart attacks don't always start with crushing chest pain. Sometimes the signs are subtle. That's why remembering rush chest can be a lifesaver. R. Referred pain. Pain spreading to the arms, neck, back, or jaw. That's a red flag. U. Unexplained. Sweating cold sweats out of nowhere? Your heart might be in trouble. S. Shortness of breath. Feeling like you can't catch your breath? It could be a sign. H. Heart fluttering. Irregular heartbeat or palpitations? Pay attention. Chest pain or pressure. A tight, squeezing sensation in the chest? Take it seriously. T. Timely action. Time is everything. Call emergency services immediately. Sixth, a heart attack isn't always obvious, but the 4 Ps can help you recognize the warning signs before it's too late. Pain. Continuous chest pain that may spread to the jaw, neck, or arms, that's a major red flag. Pale skin. Looking unusually pale or ashen, the heart may not be pumping effectively. Pulse. A rapid, weak pulse could mean the heart is struggling. Don't ignore it. P. Perspiration. Cold sweats or excessive sweating, it might be more than just stress. Lastly, when the right side of the heart fails, blood backs up into the body, leading to fluid overload. The REST mnemonic helps you remember the key symptoms of right-sided heart failure. R. Raised jugular venous distension, JVD. Notice a bulging vein in the neck? That's a sign of blood backing up. E. Edema. Swollen legs, ankles, and feet? Fluid retention is a common symptom. S. Swelling of the liver and spleen. Enlarged, tender organs can mean the heart isn't pumping effectively. T. Tummy, discomfort. Fluid buildup in the abdomen can cause bloating, pain, and digestive issues. When the left side of the heart struggles to pump blood, fluid backs up into the lungs. The LUNG mnemonic makes it easy to remember the symptoms of left-sided heart failure. L. Lungs fill with fluid. Shortness of breath and difficulty breathing, especially when lying flat, are key signs. U. Unable to breathe well at night. Waking up gasping for air? Nocturnal dyspnea is a warning sign. N. Nocturnal cough. A persistent cough, sometimes with frothy or blood-tinged sputum, could indicate fluid buildup. G. Gasping for air. Breathlessness with activity or even at rest means the lungs aren't getting enough oxygen. Master heart failure mnemonics and boost your clinical confidence. For more in-depth study resources, visit shop.latrinawaldenexamsolutions.com. Don't just study, study smarter.